Hey guys, this is Dr. Steve, and in today's show, we're going to talk about blockchain. This is a technology rumbling fast and furious. It's getting into the business world. A lot of experts believe it's going to be more than simple disruption. It's going to actually have the potential to create a brand new foundation for the way that the global economy and social systems work, much like the internet back in the 1990s. For a lot of people, blockchain is a term, even though it's popular, it's often misunderstood, and that's going to end right here, because I'm not going to just bring you the easiest explanation about blockchain. I'm going to clear up a lot of misconceptions about it and Bitcoin. We're going to dive right now into how blockchain appears to carry a huge upside as a major saving grace to skyrocketing costs, also how it deals with fraud, cybersecurity, and a lot of inefficiency in healthcare. It's Dr. Steve on Understanding Blockchain, right here on Red Hot Healthcare. Let's go.
3 alarm and 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. One of the biggest faux pas that I come across, especially when I consult on consumerism, is that I find very smart, talented, experienced individuals who really don't know how to easily explain a concept. They use a lot of big words, they speak over people, and assume that everybody else just gets it. Well, in today's podcast, it's going to be more plain speak. We're talking about a highly technical and powerful subject in blockchain. So if you're not highly technical, you'll really appreciate the way you're going to be brought up to speed here. And if you're already familiar with blockchain, or you grasp the technology easily and quickly, then hopefully you'll be able to appreciate and better able to use this if you're going to share with other people, perhaps less gifted than yourself. So when we first start speaking and learning a blockchain, we've got to talk about Bitcoin because the two are essentially linked. Let's get into Bitcoin first. And as a side note, if you invested $500 in Bitcoin when it first came out about 7 years ago, let's say you did it for your kids' college or on a whim, as of this past Friday's close, that little drop in the bucket would now be worth just a bit north of $20 million. That's the growth in value that's been recognized. And a lot of people believe that Bitcoin, being this online currency, and the blockchain technology it uses is super explosive, the same way the internet was back in the early 1990s. Now that your ears and eyes are wide open, I'm going to start with the strange but true story of Bitcoin and blockchain. Okay, so let's go back to 2008. And at that time, there's a programmer known by the pseudonym Satoshi Nakamoto. This is the inventor of Bitcoin. Now, to this day, nobody knows who the identity of this person is, and some people even think it's a group of people. But Bitcoin is basically a system for online parties, like individuals, businesses, governments, other entities, to send and exchange digital assets. And those digital assets are called Bitcoins. I want you to think of it like having an online bank account. And every Bitcoin user has what's known as a digital wallet, which stores their Bitcoin value. So it's just like having an online bank account with, let's say, real dollars. In Bitcoin, there's 4 wallet types, and it depends on where and when you want to connect to the internet. There's a Bitcoin wallet if you're going on your desktop. You need a Bitcoin wallet if you're going on your mobile. There's a Bitcoin wallet if you are going on the web when you're not on your desktop or mobile. And then finally, there is a super secure hardware wallet, which is typically in the form of a plug-in, a smart card, a USB stick. I've even seen it on credit cards in the form of a chip. What's really important here is no matter what type of digital wallet you create, once you create it, that's essentially your Bitcoin account. And you are not known in that account by your name, your address, or anything that identifies you. Instead, what happens is you're labeled by a really super secure string of numbers and letters, like a long code. And apart from the account code name and the value of how many Bitcoins you have in that account, every wallet also contains or is a private key. When you think about a key, a digital key, think about this being essentially your agreement or signature to every and any exchange where you're going to receive or you're going to send some sort of Bitcoin value. And something else that's important to note here regarding Bitcoin, and this is really quite advantageous and for many people highly desirable, digital wallets can be set up either by known or anonymous means. So your name or identity doesn't necessarily have to be attached when you create a digital wallet unless you want it to be. Just a single Bitcoin worth presently close to $2,400. It's really common to see Bitcoin exchanges in decimal values under 1. So let's say for a $12 lunch, you would pay 0.005 Bitcoin. Or if you wanted to buy let's say a high-end PC laptop where you'd pay $1,200, today that's going to be you paying 0.5 Bitcoin. So really the beauty of Bitcoin is you're exchanging a type of online currency without any third-party intermediary. All right, there's no bank, there's no government, there's no credit company sitting in between the transaction. But it's important to know the transactions are tracked. And this is where we're going to get into what a blockchain is and what blockchain technology is all about. Just like a bank, let's just take Wells Fargo for an example. They would have a secure database ledger, and that's going to record all their user accounts, their user account values, all the transactions that go in and out of those accounts today. Well, Bitcoin has its own ledger. However, it's really a special type of ledger. And the ledger is online. It's not centrally located on a secure server or perhaps a company network. So instead, for Bitcoin, the online ledger is what's known as a distributed ledger. And that ledger actually is shared and distributed among millions of Bitcoin users. So, in other words, just imagine we have millions of wallet holders on the Bitcoin network, and they have the exact same copy of the ledger. And so every time any transaction happens on Bitcoin, all the ledgers located on every personal computer machine are immediately updated. Even though those people may not be a part of any of the transactions, they still get the updates of all those transactions on their online ledger that they're holding on their computer. Okay, so this is a very important point. The online ledger of Bitcoin grows with every transaction. So no user can remove or go back or edit any transaction. Once a transaction on Bitcoin happens, somebody sends a Bitcoin to somebody else, it's tagged with a timestamp, it updates on the ledger and therefore on everyone's computer, and then that transaction, just like all the other transactions, just will stay on the ledger forever. And another thing about Bitcoin and the entire system that's important to know, and about the ledger, you can never simply add Bitcoins in without a transaction. So when you look at a lot of governments today, and you look at their monetary system, whether it's the United States or China or Russia, a lot of these countries today, they're just simply printing money and putting that money into the monetary system of their country. And they do it for a lot of reasons. The biggest reason really is by flushing in a lot of extra money. What you're really doing is devaluing the currency. Governments, for their own benefits and purposes, can essentially manipulate their monetary systems. Well, that doesn't happen in Bitcoin on this ledger system. What winds up happening is there are no Bitcoins that just get pushed into the system. They either have to be sold to somebody or they have to be given to somebody. That's it. There's another way where they're actually earned, but that's not for this particular lecture. Let me go ahead and just give you a crude example of what I'm talking about, just so you have a better idea here. Let's say there's myself and 3 friends, Mo, Larry, and Curly. And we are the only 4 people on Bitcoin. Each of us have 10 Bitcoins. So essentially, the entire Bitcoin system, globally, has 40 Bitcoins and 4 users. No more, no less. And let's say I send 5 Bitcoins to Curly. Now the ledger is going to update. So Curly has 15 Bitcoins, I have 5 Bitcoins, and Mo and Larry, they still have their 10. Even though Mo and Larry were not part of the exchange, the online ledger that's stored on everyone's computer is going to automatically update as well. So you get it? Good. Why is Bitcoin's ledger one that's set up to be widely distributed? Why is it non-centralized? Well, first, it makes the entire system open to the public. And that means that we talked about before, unlike governments that just print extra money and devalue their currency, what winds up happening is there's a level of trust and there's a level of accountability into the system. That's really important because without trust and accountability into the system, no one's going to use it and it's not going to grow. People are using it, it is growing. The second reason to have a really widely distributed ledger is security. So if you go ahead and let's say you have Wells Fargo ledger and it's within their specific network. Well, let's say the network's hacked and it affects the entire system, right? We see this not just with banks, but we also have seen this in healthcare. Well, if a hacker attacks a network, one network or one computer, it can really crush a lot of what's on there, the software, the applications, the data. But because the entire Bitcoin ledger is distributed to millions of people, what winds up happening is the system really can't be hacked and corrupted. So that's reason number 2 that it's great that it's widely distributed. And the third reason is because peer-to-peer exchanges, that is, if I send you a Bitcoin or you send me a couple Bitcoins, a lot of the cost that's involved in exchange is removed. So this is cost that's usually passed on to consumers and users. And when we start talking about healthcare in a little bit, that's going to become really important. And the fourth reason for a widely distributed network is because it protects our online identity and reputation. When it's decentralized, essentially the data, our account data, and the transactional data, it all belongs to us. And that's very, very important. Most important, though, for as powerful as this is right now and will be, it's important that you know Bitcoin is an application. The actual backbone, the technology of the distributed ledger that makes Bitcoin go, that is like the operating system of Bitcoin, that's what's known as blockchain. In the beginning, a lot of people focused on Bitcoin, the application, as the actual valuable tool, and it's extremely valuable. It's growing. I mean, today Bitcoin is one of just 700 different types of what's known as online or cryptocurrency. All of them use blockchain technology or what we know as distributed ledgers. So the point I'm making is that the real value, the value that can go far beyond Bitcoin and far beyond just the financial sector, is really the distributed secure database or the distributed secure ledger. That's what blockchain is. Blockchain is that widely distributed ledger that you can never take away from and that consistently and historically just gets added to and shared wide and updated with everybody. And blockchain technology has a future where it's going to be able to hold and share not just online currency, but really any type of asset. So we could look at homes, real estate, gold, stocks, bonds, carbon credits. You can even get into patents and brand names and consumer sale transactions and, as we're going to talk about, patient data. There's a lot of major companies out there, IBM, Walmart, Microsoft, Google, Amazon, Samsung, and they're all making financial and resource investments in blockchain for all types of business segments and all types of consumer-related goods and services. So let's get out of that now that you have a better understanding of blockchain and what that is, and let's get into healthcare. The premise to this discussion about healthcare is pretty much now more than ever, we've got a healthcare system, guys, which is largely unaffordable to the citizens and even now to many companies. Whether we're talking hospitals, health systems, post-acute care, drugs, or even healthcare coverage itself, the costs have skyrocketed. And really, the system as a whole is largely unsustainable. And so we can add to that the tremendous upsurge in all sorts of cybersecurity threats and hacking. We've got healthcare fraud and waste at super high levels, and patient data portability and interoperability. We know the fix for healthcare affordability to make this system more sustainable has got to include the following. Number one, we've got to drive down cost. Number two, we have to increase the quality of care. Number three, improve the outcomes, right? Number four, we got to strengthen the security of that patient data, especially the cloud-based data. 5, we've got to decrease the risk. So now that providers and all sorts of hospitals, drug companies are going to start taking on greater risk for payment. And then 6, we've got to drive greater efficiency. And I would probably add as number 7, that as a whole, we need to be able to start increasing the switch from healthcare or disease care into wellness, especially with our levels of chronic disease. And of course, with all of this, the big trick is we have to keep our healthcare companies profitable, because whether you like it or not, our healthcare system is largely for profit. If we start talking about payment amounts that are going to be decreasing when we start switching to value-based care, healthcare companies, drug companies, they're going to need to see more patients, provide more services, and they're going to have to be able to lower their costs. That's how they're going to be able to stay profitable and keep more people employed. So let's remember, blockchain is the distributed ledger technology. So any blockchain solution for healthcare is going to need to have that distributed ledger technology, and then applications are going to have to be built on top of blockchain. So you talk about companies now like Amazon's AWS cloud, Microsoft's Azure cloud, or Google's cloud, that these are platforms for the web that people are building applications on. Now the big companies like Microsoft and IBM are already developing their own powerful versions of blockchain, basically creating blockchain platforms. So again, just like other platforms to build applications, here, what they're looking to do is encourage companies, existing companies and entrepreneurs to come in to essentially build new applications for the healthcare industry. This is Dr. Steve Ambrose. As a healthcare influencer, I'm in contact with some of the brightest minds and most powerful leaders in the industry, but my best effort comes from outside the booth. Knowing how to engage patients is an art, science, and philosophy that I know very well. I'm a hired gun that brings expertise to healthcare organizations of all types. You've heard my words. Now read my thoughts on my free white paper called The 7 Mistakes Made in Patient Engagement. Just go to redhothealthcare.com/learn. That's redhothealthcare.com/learn. While you're on the site, dive into my consulting and speaking services and schedule an initial call. You won't regret the uniqueness, benefits, and results I can deliver for you. And now, back to the show. So let's get into the meat of the matter, guys, right here. We're going to start talking about where blockchain can make really the biggest differences in healthcare. The first area, and I think one of the major areas, is going to be interoperability. According to many hospital administrators, the number one issue that affects patient satisfaction, and not to mention the risk that the providers are having to take on and the care outcomes that they need to improve on, the number one issue is going to be care coordination. And care coordination comes and is chiefly solved when you have better levels of data. When you start managing EHR or electronic health record data with trusted timestamp changes, this is what's going to make blockchain really well suited to not only add new information on patients and be able to share that, but the nice part is that patients will start to actually own and control how that data is shared. So interoperability for EHRs and EHR data being shared with each other, that's one point. Another area that I think is really key are some of the inherent trust issues that go along with interoperability. We start talking about patient IDs or patient identification, patient consent to agree to fees, to agree on services that are going to be done, to participate in drug trials or research, providers getting their authorization, and then even monitoring and discovering billing fraud. All of this can be handled within blockchain. And important also, patients and providers can easily join this decentralized ledger, this blockchain technology. Now remember, we're building an application on top of it, but at the core, we're talking about a decentralized ledger database, and really the power of that is in the fact it's decentralized. You've got special agreements and legal pipes that go on today where you have hospitals, medical device companies, post-acute care facilities, drug companies, labs, and they're selectively choosing to share with each other. Now, some of them join HIEs, some of them join other initiatives, but by and large, there really is no central environment that's trusted by everybody. And this is where I see blockchain and the ease of getting into and using blockchain technology towards helping a lot of these issues. And lastly, we start talking about being able to switch from what is today disease care in healthcare to wellness. So this all falls under interoperability. So now you start talking about blockchain databases, being able to actually integrate with patient lifestyle, mobile health applications, and then what's also growing on the back end, which is the Internet of Things, the IoT environment. And look, I've said this before, guys, patients have an inherent responsibility to help our healthcare crisis, to make our healthcare system better. They can't just go through life, not be accountable, and drop their disease off at the door. That's not going to work anymore. The second area for blockchain in healthcare is going to be claim adjudication. Let's start this off by just recognizing that billions of health claims are generated every year. And if we want to look at estimates, 5 to 10% of those claims are deemed to be fraudulent. Most of them are probably not going to be found out. Plus, on top of that, you have 1/4 or 25% of all hospital costs are administrative. And a lot of those administrative costs are based on payer and patient billing. You start getting a trusted network shared between the patient, the provider, the payer, and now what starts to happen is you really allow for much better transparency and a lot more efficiency, especially when you start checking the billing claims against the actual service that's held within the blockchain. And remember when we start talking about decreasing costs? This is where it comes from. Jobs are going to be lost, but they're going to be lost anyway, because what's happening is when you make systems more efficient, more trustworthy, more scalable, you start to recognize that you're taking a lot of the manual processes out of it. And if we want to start decreasing cost and presumably passing on those costs as greater affordability to the masses, then there's going to have to be improvements made. And this is one major area where blockchain can make a big difference. Okay, guys, moving on to number 3 of 5, we arrive at pharma clinical trials and drug development. Let me start off by saying that the pharma industry, widely untrusted because it continuously raises drug pricing. They give us the same old line, quote, "We need to cover our R&D costs so that we can keep making better drugs." Okay, prove it. Because guess what? The estimates today that are agreed upon is that as much as half of drug trials, especially failed drug trials, go unreported. And often, drug investigators fail to share the study results. So when you get into a value-based system, we start talking about health policymakers, payers, certainly doctors and patients. They're not getting the level of transparency they need when we start talking about a value-based market. That needs to change. We start to begin to address fraud, abuse, misreporting, outcome switching, data snooping, selective result sharing. This all goes towards driving down cost and pricing in drugs. Plus, when we start getting into precision-based medicine and more personalized medicine, we start getting into a situation where we need best data and results. Number 4, cybersecurity. And this one's pretty self-evident, but the statistics are absolutely mind-blowing. 59% of the decision makers in healthcare made the claim that their security and their data privacy is the biggest challenge that keeps them from integrating different sorts of connected devices into their organizations. So they're being held back, results are held back, improvements held back because of the threat of being hacked. Almost 50% of healthcare organizations, half, claim that they're not confident in their ability to keep their cloud data secure. 9 out of 10 healthcare organizations report suffering a data breach in the last 2 years. And we're talking about not just costs in the billions, but we're also talking about the cost to insure. We're talking about the amount of people you have to keep on board in terms of the IT. The other thing we need to talk about, too, is the Internet of Things. We're talking about the medical Internet of Things, this ecosystem that's needed to pull in better data. Well, blockchain can provide the trusted ecosystem needed to allow for devices to connect in. We can now start to realize with IoT coming into play, we're going to get more and more lifestyle data that's going to be accurate. Again, it's going to be verified, and it's never going to be edited. So the great thing is that we're talking about trust here. With that blockchain ecosystem, the shared ledger, it makes the security so much stronger. The design is so much more protected. I mean, it wasn't too long ago that Cigna got hacked and millions upon millions of people had their accounts exposed. You need to start looking at creating a better system that inherently just has a much, much greater chance by design of being strong and impervious to hackers. And that's where blockchain really makes a big difference here in cybersecurity. So I expect that to be a big, big player moving forward. Coming down the home stretch, we are in the last area where I see blockchain making a substantial difference for healthcare. And that is number 5, supply chains. And the medical supply chain today, we're talking about pharmaceuticals, we're talking about non-prescription medications, and medical devices. We could also be talking, too, about medical equipment. But in short, look, we need safer care, better results, and we need outcomes that are going to be really consistent with what we're working towards in value-based care. Blockchain's shared ledger, it's going to provide a really well-trusted environment, seamless trusted environment for drug and medical device manufacturers. Not to mention the suppliers and then the buyers, the hospitals, the providers, the pharmacies. One of the areas of concern that I see is the quality of drugs, the quality of devices. Another key area for supply chains is what's known as smart contracting, smart contracts. And that happens between different parties, and it's inherent in this blockchain technology. Essentially, when you have a smart contract, it allows all parties through this distributed blockchain ledger to be able to see the terms of the agreements, and then to match up how well the obligations are going against those terms. So you look at the manufacturing, the delivery, the location, the tracking of shipments, the effectiveness. All of those get baked into the contract terms. All of those are areas that are largely today controlled by humans. They have to check it. They have to update the system. Phone calls have to be made. All of this human intervention, all these manual processes get added into the cost of drugs, medical devices, and of course those get passed down to the consumer, to the patient. I see this as a final area where blockchain will make a substantial difference. Okay, guys, let's wrap it all up. Blockchain is essentially a relatively young and powerful technology, and it is based on the use of a decentralized, highly secure online ledger. The ledger is set up to always update, and it shares those updates with large groups of distributed users. The ledger entries can never be edited or removed. They're there for all of history. It's publicly transparent, and the design provides a tremendous level of trust and security. The blockchain technology, in its design, it's made to cut through and reduce the middleman. So, in a lot of cases, it's going to look to cut costs by eliminating human-based jobs, vendors, different types of governments operating as middlemen. And apart from driving down the cost, the other thing that blockchain does is it provides for greater privacy and control of data. Users have a better opportunity to capture and control their own data. Blockchain is the operating system and applications for all types of business challenges. In all business sectors, they're built on top of the blockchain platform. Bitcoin is an example of one type of application, and there are going to be many, many others. Because there's so many needed changes in so many different segments of healthcare, there is an incredibly ripe opportunity for new applications. Applications that are going to use blockchain to lower costs, decrease risk, provide better outcomes, improve interoperability, establish more trust, and also to prevent future cyber attacks. I want to thank you for listening. You can always reach me for consulting by going to redhothealthcare.com/consulting or by emailing steve@redhothealthcare.com. I invite you to subscribe to our show on iTunes, Stitcher, or other podcast players, and drop me a line if you have any questions about today's show, or if you have an idea for a future leader guest on Red Hot Healthcare.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.